Hello, I'm Tim Sandel and welcome to my latest video about coronavirus. Last week we looked at conspiracy theories and we looked at those kind of theories that say that the novel coronavirus was artificially created in a laboratory in China, and we've dismissed those. The virus is of natural origin and coronaviruses have been with us for millennia and many cause mild illnesses. What we've seen recently with the novel coronavirus is several outbreaks of human diseases, and this is due to mutations triggering structural changes in the coronavirus spike or S glycoprotein. And this change has facilitated the coronavirus making a jump from animals to humans, and with that bringing new disease factors. Anyway, today's topic is all about the built environment and transmission risks and measures that people can take in order to keep their homes and offices safe. And it's an important area to look at, given that we spend most of our times in buildings. Even under normal practices, we may well spend 90% of our time in buildings. So understanding the transmission dynamics of the coronavirus is important. So to gain greater insights, scientists need to look at factors like human behaviour, social dynamics, building operational factors, and seeing how each one of these can potentially promote and then what we can do to mitigate the spread and transmission of the coronavirus. Now, we know that the ways the virus spreads is generally due to three interactions. So this is between individuals, from fomites, which is the general term for objects carrying infectious diseases, and through viral exchange and transfer through the air. Now, it isn't rocket science to understand that the higher the occupancy density in a building, together with greater activity, increases the level of social interaction and hence the connectivity through individuals, and then the greater chance of virus spreading. And as people move through buildings and offices and go about their day-to-day activities, then there are direct and indirect risks with surfaces, with viral particles being deposited and resuspended in the air due to natural airflow patterns or mechanical airflow patterns that might be delivered through building air conditioning or ventilation systems, and also other sources of turbulence that arise from the indoor environment, including just walking around, for example. And these resuspended viral particles go back onto surfaces, people pick them up, and the cycle continues. It's also important to understand that infected individuals with COVID-19 can shed viral particles during, just before, during and after developing symptoms. Now, viral particles can also come from the outside. So for homes and offices with ventilation systems, these are unlikely to be effective. So the way that is assessed is looking at something called the minimum efficiency reporting value, or MERV. So most homes and offices only have ratings of around 8, which can capture 70% of particles of 3 to 10 microns in diameter. But these are far too large, far larger than viral particles. So most homes equipped with ventilation systems, and certainly offices, are not really going to be able to exclude coronavirus. So what can be done? Well, with a typical building, the simplest way to deliver outside air directly into the building is to open the window, and to open the window as wide as possible. And window ventilation can increase the outside air fraction and therefore increase the total air change rates within a room, which then ensures that fresher air is coming in and air that might be containing dust and particles and potentially virus is then removed. However, thought needs to be given to this if there are other residences or other offices in very, very close proximity, because then there's a risk of cross-contamination through that. But if there's the opportunity to open the window, that's good practice. Light can also form part of a mitigation strategy. Now, studies do show that daylight does shape the indoor microbiome environment. So that is that dust containing microorganisms that is subject to sunlight tends to contain less harmful infectious agents than dust in darker areas. It also stands that to a degree UV light can help with the inactivation of coronavirus, but generally that's not overly effective because of the particular wavelength and exposure time, but equally it's not going to do any harm either. Another factor is humidity. So based on data relating to earlier the original SARS and the MERS virus, we know that the viability of coronavirus in aerosols is going to be lower in relatively higher humidity levels. So if we have a relative humidity rating of 50%, there's going to be fewer viable viral particles than, say, if the humidity level was 30%. So if humidity can be increased, this can be helpful. Okay, and then we have the standard practices, and there's no harm in going through these again. So we need to have proper hand washing procedures, and that's vital for controlling anyone who might come into contact with others who are infected with the SARS-CoV-2 virus. And we know that washing hands frequently with hot water and soap for 20 seconds is effective. We also know that regularly disinfecting surfaces is important. There's ample scientific evidence to show that ethanol at 62 to 71% is very effective for eliminating viruses from surfaces, and there's a range of common types of surfaces. Now, with sinks, items that should be removed from sink areas as far as practicable, and this is to ensure that aerosolized water droplets from the act of, say, washing something, and it might be carrying aerosol virus particles, could then land on commonly touched items. So keeping sink areas clear is really important. It's also important that countertops around sink areas are disinfected, and here either using the alcohol or the ethanol at 62 to 71% or a 10% bleach solution is going to be effective. Other than that, of course, we need to maintain physical distancing, as we cannot tell who might be infected and who is not infected. So the best way is to continue avoiding large gatherings or associating more than within 2 meters of somebody else. And this is also referred to as social distancing. And the fact that we have travel bans in place and other mobility restriction measures is also really important in the fight against the virus. Face masks, we've already established in previous video, are not overly effective with asymptomatic individuals, and it remains important to preserve masks which are still in short supply for healthcare workers or family members who need to be in constant contact with individuals who are infected. It also stands, and this is a strong point that I've made before, is that wearing masks can give a false sense of security, particularly when moving around contaminated areas, and also the incorrect handling of masks can increase transmission. So masks should be regarded as infectious waste items. Okay, so that's it really for this video today. What we've covered are the mitigating factors and transmission aspects around being indoors, be that in your own home or as you go back to work, being in an office area. Small things that can be done in addition, and practicing those measures that have been reinforced multiple times. So we've looked at several other coronavirus related topics in the videos in this series, and these can be found on my YouTube channel. So please subscribe to look at previous videos and to receive future updates. So I've been Tim Sandel, and please continue to stay safe.